Hello, everyone, and welcome to today's APS Teaching of Physiology section webinar entitled Using Interactive Drawing Tools to Teach Neuroanatomy and Physiology. I will be serving as your moderator today. My name is Dr. Alice Villalobos, and I'm a longtime member of the American Physiological Society and the current chair of the APS Teaching of Physiology section. In today's session, Dr. Radmila Filipovic will discuss the ways in which visual learning tools can help students better understand the structure and function of the neural pathways and related pathophysiology. A few housekeeping notes before we take a short poll, but out of respect for our speaker, we ask that you refrain from photo and video captures of the presentation in whole or in part. The session will be recorded and available for your future viewing through a link on the registration website. Taking photographs of another person's presentation without their permission, explicit permission, is also prohibited. Let's see. Actually, Jacob, can you help me push that poll out real quickly? There you go. So if you all wouldn't mind just quickly filling out this poll, that would be great. And then we can get started. And we'll give you about a minute to do that. So leave the poll open just for a bit longer. We're getting some new people as well. All right, thank you. So at this time, I'd like to ask all attendees except for the speaker. Okay. All of you will be in listening mode only with your videos off. As moderator, I'll be happy to raise questions that are entered into the Q&A function at the bottom of your screen. And before we begin, I would also like to thank today's sponsor, Ditki, otherwise known as Draw It to Know It, for their support of our section's awards and social activities. The session will end at approximately 12 p.m. noon Eastern time. So at this time, it gives me great pleasure to introduce and welcome our speaker, Dr. Radmila Filipovic. She's actually a professor in residence in the Department of Neurobiology and Physiology at the University of Connecticut at UConn. She serves as the academic director of UConn's master's program in surgical neurophysiology and lab coordinator for the human physiology and anatomy course. So welcome, Dr. Filipovic. And at this time, I'm going to give you the floor. Thank you so much for being with us today.
Thank you so much for a nice introduction. I'll share my PowerPoint. Sorry. Okay, so good afternoon, everybody, or good morning. I'm very excited to present my talk, and I would like first to thank American Physiological Society and Draw It to Know It for inviting me and giving me opportunity to present my work and my use of Draw It to Know It and my tools in teaching neuroanatomy. So as was introduced, I'm professor in residence in Department of Physiology, Neurobiology, and University of Connecticut. And my webinar overview I will a little bit talk about myself, my background. I will talk about what courses I'm using for which courses I'm using Draw It to Know It, and then what is the student target population. Then you can relate to your courses, whether you can use that in your courses or not. Also, I will describe how I use these tutorials in two different levels of students, to undergraduate and graduate students, and I will provide some examples how I implement those draw it to know it assignments in each level. And then I will talk about positive outcomes and some challenges which I'm facing using draw it to know it. I will end up with a slide which will provide you some information how you can test this program and how you can use in your courses. And a little bit about myself. So I'm from Serbia. Serbia was part of bigger country, Yugoslavia, which had a war in the 1990s. And I came to US in 2000. I got my PhD in neuroscience from University of Belgrade. But I did all my experiments in University of Connecticut Health Center, which is on the right side. You can see that image. So where I did also some postdoc after my graduate studies, and then I joined to Physiology Neurobiology department through 2007, where I'm still working as a professor in resident. And my job is primarily in teaching neuroscience, neuroanatomy, anatomy. So reason I'm mentioning Yukon Health Center is that that really plays a bigger role in my love for teaching neuroanatomy, because I started teaching neuroanatomy there, helping teaching neuroanatomy to the medical students in health center. So which courses because this talk is about draw it to know it tutorials. There are two courses which I'm using these tutorials. As I mentioned before, undergraduate and graduate course. So first course which I offer is a human neuroanatomy, which is usually taken by the juniors and seniors. And I typically have around 60 students per semester. I teach it in the spring semester. And the other course, which is graduate course, is part of our master program in surgical neurophysiology, and the other name is intraoperative neuromonitoring. So that course is larger. First course is 2 credits, second course is larger, 4 credit, but both of them have a lecture and lab component. And in intraoperative neuromonitoring, we have 24 students yearly. So both of courses are using draw it to know it in different level, and different tutorials are included in each of them. So you can think about like what kind of students will be interested in taking neuroanatomy, because neuroanatomy is in undergraduate is covered as part of anatomy and physiology. But it is not really like a very detailed, it's not taught very in detail. And so with introduction neuroanatomy, when I proposed that course, I was targeting different students. And in our College of Liberal Arts Science, there are a couple of departments where students are coming from my class. So there we have molecular cellular biology department, our department of physiology, neurobiology, EEB, and psychological science. The other students which take neuroanatomy in junior senior years are the besides physiology and neurobiology, we also have allied health. We have, as I mentioned, psychology and biology in general. So those are usually students who are pre-med students, pre-dental students, future physician assistants, future researchers. So students who like neuroanatomy and neurophysiology and want to learn more about that in the specific class. So how we teach at UConn neuroanatomy, we are very lucky to have anatomers table, which is basically one big iPad where all images from the cadavers are rendered in 3D, and the students can use that like they have different tutorials and different platforms. where they can learn different system, and besides all other system, of course, nervous system is big part of that table. So those are team-based activities, and actually anatomy table is used in many schools and medical schools as well, and it's proving to increase the student anatomy scores by 30%, and we can see that in our classes as well. And it has, as I mentioned, it has really nice tutorials which students can, in specifically neuroanatomy, can explore different dermatomes, touchpad, so they can also, when touching the screen, they can see different nerves, different, for example, here is sciatic nerve. They can see distribution of the spinal nerves from the spinal cord, and explore nervous system in that way. So another tools which I use over the years are we also have an online platform which was particularly useful during COVID time. VJ Sector from Toltec company, where they have again, those are 3D cadaver images, but it is online platforms with many lessons which students can use to learn neuroanatomy and other anatomical systems. Also, in the same time, around COVID time, I discovered wonderful tutorials from the University of British Columbia, which I still use. And so those are have the interactive modules, they have videos, they have different tutorials which shows functional neuroanatomy. And then also we made around before COVID, which was fortunate, a lot of dissection movies from the sheep brain dissection in collaboration with the Center for Excellent Teaching and Learning at Yukon Health Center. So as you know, like to make the neuroanatomy and neuroscience more relevant, we try to combine that knowledge from anatomy with real cases, and we use case studies models like many other schools. And what we will be using recently is role play model, where students are divided in different groups, and they each have their own role. One is the patient, one is doctor, one is the nurse, and then they go and then explain all these symptoms to the class, and they learn by that team activity and role play model neuroanatomy. So we do everything what we can to not have bored students like this in this slide, because neuroanatomy is not easy to teach, and could be very overwhelming with a lot of different structures and a lot of pathways, and it could be very confusing. And we try to make that more interactive and more relevant for students, and try to spark some like love for the neuroscience and neuroanatomy. So we use in our classes, we use flipped classroom, which is we pre-record some small extracts from the classes before class, when they have to learn some basics, that when they come to the class they have some knowledge. And then we draw on the board, or recently I've been using iPad during class to draw, and then to share my my drawing, and then hopefully some students, everybody is encouraged, but some students draw along during classes, and then they learn in that way. So also we assign drawings before the class, and then reproduce the simplified images during the lectures. So the other tool we use, we have small whiteboards, and we assign students during classes to reproduce some images and teach each other, so peer-to-peer teaching using whiteboards. So so how I really like, I like to draw. I'm not really good in portrait drawing, but I like to draw like those simplified cartoons and then concept maps. And when I was in the Yukon Health Center, during my postdoctoral studies, I had to teach. I was assigned to teach neuroanatomy to help professors to use to medical students. Of course, I was terrified, but still teaching neuroanatomy. So, and I developed really love from neuroanatomy. And one thing what helped me to teach neuroanatomy was this book, Clinical Neuroanatomy, Made Ridiculously Simple. And that time was edition 3, now is edition 6. And actually, medical students recommended me that book. So that book has a lot of drawings and fun drawings. And this is on the right, is my drawing, which is probably you don't know what it is, but maybe some of you know, hopefully you know. This is the midbrain in caudal and rostral midbrain, and a section of the midbrain where they explain what is the difference with those two sections by using the two landmarks. One is the inferior colliculi, and the other is superior colliculi. And the inferior colliculi, they draw with the frown, and then with smiley face, superior colliculi. So that was kind of fun for me to combine drawing with some like more fun way to explain your anatomy. So I was very glad that when I joined the department neurobiology and physiology and started teaching full time, I was very glad that one colleague of mine recommended. Actually, she shared information on Draw It to Know It 10 years ago, and then she gave me some flyer. I'm not sure how she found, and then I really got interested right away because I like to draw. And so in 2015, I got some small mini grant teaching award to develop neuroanatomy course for undergraduate students because it did not exist at that time, and to incorporate the Draw It to Know It tutorials. And so I got that pilot grant and then start using Draw It to Know It and continue using, still up to date, I'm using Draw It to Know It. So our collaboration is more than 10 years old right now. So what I'm showing in this slide is a screenshot of the Draw It to Know It tutorial I use. And what I circle here is the study plan for undergraduate neuroanatomy. So I will show you shortly how you can make your own plan. So so then also Draw It to Know It not only helped me teach that more fun and more engaging and more to help students visualize where all the structures are in the brain, but also helped with the grading system because students did not largely depend on the grade on the exams. My exams were 50%, Draw It to Know It assignments were 20% of the grade. And then I also incorporated some quizzes, such as Slido quizzes, weekly quizzes, and that is all part of the grade. So students get in the beginning of the semester, they get instructions how to subscribe for Draw It to Know It, and then I'm a Draw It to Know It team assign me my PIN, and then they joined my study plan, which I created for them. So I create my own study plan, and they follow instructions in my study plan for that class. So this is like on the right side, you can see some of the assignments which I before the class. So this is, as I mentioned, this is for undergraduate class for the spring semester. I assigned them some drawing and before class and after class. And in the class, we draw that content and then teach them explain that concept which they already heard and saw in Droid to Know It. So I will now try to share the screen of the Droid to Know It. Give me 1 second. So I'm sharing screen, I hope. Yes. So I'm can you see my screen? Droid to Know It. So I hopefully, yeah, okay, thank you. So I want to show you first, how to log in my account and show you some of the courses. So there are different courses, and but I'm using neuroanatomy course, which is in the medical graduate subjects, and my course is neuroanatomy, and I have different study plans. So for example, in the study plan here, where I have all these tutorials, you have other materials such as atlases and directories. You have different
Dr. Filipovic,
flashcards.
we can only
Yes.
see the PowerPoint. We can't see the.
Oh, I'm sorry. Okay, thank you. Oh, that's, sorry. That is good to know. Okay, so now you can see.
Got it.
Okay, I apologize. So so this is a Droid to Know It tutorial, and then you can see here I already log in my course, which is neuroanatomy course. So besides tutorials, which are in the lower panel, there are a lot of other tools you can use in your classes. For example, Atlas and Directory, you can see a muscle nerve directory, which is also very relevant for neuroanatomy. You have some MRI Atlas. So you have there are a lot of other material which is available for you. But now I will show you my study plans. So there are different study plans, and I have for undergraduate one study plan. For my graduate program, I have the other study plan, but you can always create a new plan. So I will briefly show how you create new plan. You click on create new plan, and for example, you say test, and then click select tutorials. So what I usually do, I deselect all and then select what I want to include. For example, first one, if I select introduction neuroanatomy and orientation on neuroanatomy from this tutorial, and from the next tutorial, peripheral neurohistology, and saved study plan, students, when they go to that study plan, they will have only that tutorials visible. But they can always go to check all tutorials. So you can customize your own tutorials, but students have, with their subscription, they can see all tutorials as well if they want to know more and to study more material. So that is how you create your own tutorial, so a study plan, and you can select or deselect tutorials you want. So with that, I will a little bit more talk about how I format my class. Pre-class, I tell students to complete some of the drawings which is assigned in my plan. For example, when I teach spinal cord anatomy, I assign them to spinal cord anatomy to go to the tutorials, watch tutorials, and draw along tutorials. Then major tracts, and then when we come in the class, during class, I will be drawing this simplified drawings of depending on the level of the course. If it's undergraduate, I will try to simplified drawing and then explain them in my own words, and reassess that like the same concept they already saw in Draw It to Know It. So Draw It to Know It tutorials are very, very good, but sometimes for undergraduate students, they have more information they need. So in my class, I always tell them, like, this is what you need to focus. There is more information in Draw It to Know It, but for this level of the course, you will be focusing on these structures. For graduate courses, of course, I include more details. I also use some other ways to teach anatomy, such as this is on the left side. There is a cross-section of the spinal cord and labeled with whale staining from the Neuroanatomy Atlas. I try to show them neuroanatomy from different aspects. And then during class, I also ask them questions using Slido based on the Draw It to Know It quiz questions. So which I did not show you, but when you go to the Draw It to Know It, there is, besides tutorials, there are also quiz question ability. Those are self-assessment questions when they can go through the question and answer those questions. So I ask students to preview those questions, and those the same questions are similar questions are asked during class, and then help them understand material better. And after the class, also for example, for this unit, I asked them to complete sensory systems, so how sensory systems are traveling. One of the sensory system is the MLS system, which is touch and proprioception. It's very well explained in the Draw It to Know It. Students are asked to complete that Draw It to Know It. And then in the class, we will be, before the next class, we will be also, they need to draw spinal cord disorders, which are the another lesson of the spinal cord tutorial. So each part of the nervous system, we teach first anatomy, and then we end up with the disorders. So disorders are, of course, pretty difficult sometimes. And so, for example, in spinal cord disorders, you have here 9 cases. But for the undergraduate, I would pick up like a couple of cases, more easy to understand. And then I would be, during class, focus on these cases and explain them pathology from about these cases. For the graduate classes, of course, I use the same tutorials, but expand and then use more advanced material and include more cases for them to go through. So also here, there is a spinal cord disorder. So you can see here on the left side, there are table, and on the right side are the drawings. And of course, I know what it is, but you don't know what are those circles. So those circles represent, for example, a lesion here in this cross-section of the brain. This part is lesion, this orange part, or this blue part. So each of these part, which lesion, they need to know what represent. And by this time, they should know that in this blue part here represent pathways which are touch, proprioception, vibration pathways. If that is lesion, that will affect that in the patient's sensory deficits. They should know by now that orange are the corticospinal tract, which is motor system. So this is more integration of their knowledge. So typically for spinal cord, I use like 2-3 weeks because it's pretty much complex. And the other option in Draw It to Know It, which is very, very good, besides these quizzes, is exercises. For example, this shows they have, when they click exercises, they will be here are shown all these pathologies, but not in order, and then they need to label and then relate all these pathologies with the drawings. That is one more integration of the knowledge tool in Draw It to Know It. So as I also I use these tools in the master program, and master program we have in PMB we have a master program in surgical neurophysiology, and so basically that program is 1-year program in which students really need to know very well neuroanatomy, because their job is to work in the operating room and assist neurosurgeon during surgeries, and through the different recordings of muscle or sensory activities, they will monitor activities, peripheral nervous system during surgery. So they need really to know very well neuroanatomy, and I teach neuroanatomy in the beginning of our program in the summer session. So we use, again, we use, besides Draw It to Know It and lectures, we use some of the pre-recorded videos. So I made some with the Yukon Health Center and Seattle, Yukon Center for Excellence. I made a series of human brain dissections video, and we also have in our Yukon, we are happy to have a kinesiology department in collaboration with Dr. Kinsella Shaw, and then we bring students to cadaver lab, and they can also learn musculoskeletal anatomy, but also nervous system anatomy. For example, this shows brachial plexus, and then that is something what we did this summer. They learn all our nerves in the brachial plexus. But we use the Draw It to Know It as well in this class, and the most complicated structure, in my opinion, in the nervous system is brainstem, because it has so many structures and its importance of so many functions. So we spend a lot of time for brainstem. One challenge I have in our program is that I teach this neuroanatomy as a starting class, and it's in summer session 1. And in 3 weeks, I really, it's very condensed lecture. Every day we meet for a couple of hours. And so I cannot really expect students to finish all this drawing before class every day. So I give them more time to finish the drawing, assign them drawing. We have different study plan. Here is the INM, Yukon INM study plan, which has more modules than undergraduate, but I give them more time to finish that drawings. And to go back to the brainstem anatomy, so those are some examples. Brainstem anatomy tutorials is absolutely phenomenal. I asked students also, besides Draw It to Know It, to watch this University of British Columbia tutorials, because I found it also very, very good and very useful for understanding functional neuroanatomy. And I asked students to start drawing brainstem anatomy, the Draw It to Know It, and preview quizzes. So this is one example of the sagittal view of the brainstem, and those are some different sections of the, you have medulla, you have pons, and you have pons and midbrain. So during class, I go back to those tutorials and then draw, sometimes on the board, sometimes on my iPad. And I also use my own way to incorporate this Draw It to Know It. So I, for example, similar images which are in Draw It to Know It, I color code and then show, like, for example, motor system in yellow, then the MLS, which is touch and proprioception, I show in red, for the upper body, QNET fasciculus for the upper body, touch and proprioception in blue, ALS, which is pain and temperature, in green. And I show, I combine the Draw It to Know It with my own way how to teach, and then we draw all these pathways in the different structures of the brainstem. And it takes some time for them to sit all these colors and all these structures, but I really try to re-emphasize them that it's really important for them to draw them by themselves. and to find their own way how to remember and not to memorize the structure, but just connect the dots between different levels of the brain, how these pathways are traveling, for example, how we come from the spinal cord, pain and temperature, touch and proprioception from lower body, where is positioned in medulla, where is positioned in the midbrain, where is in the pons. So all that we go over during class. And we also assess their understanding using Slido questions, which are based partially by the Draw It to Know It quiz questions. And another one is we combined that new tutorial, which just like was published this summer, Draw It to Know It, which I really find very excellent, is sensory projections from the spinal cord all the way to the cortex in color coded. So they also are, we are trying to draw the same pathway and then to go step by step. So what I ask from students when I draw, that they draw along with me as well, and recapitulate those images. So application from brainstem pathology, there are different syndromes, midbrain, pontine, medullary syndromes. Again, I ask them to pre-class to complete drawings and start sketching those drawings, and after class to complete quiz, which is based on the questions in the Draw It to Know It. So how we can assess these pathologies in the brainstem? So we can assess, we can ask two kinds of questions. So how we can understand if something is damaged in brainstem, what are the symptoms? We can start with sections and then encircle the region which is damaged and ask them, what is this level of the brain, for example? And they, by that time, they should know this is the rostral medulla. Then ask them what structures are damaged and encircle in red. So in that time, they should know that this is the those are the hypoglossal nerve, that those are sensory motor pathways. So then we ask them another question, what would the symptoms? And then by this time, they should know that those are sensory motor deficits from the opposite side of the body and tongue deviation toward the lesion side. So, this is one way. Show them the section, encircle the structure which are damaged, and ask them for the symptoms. So the other way is what also Draw It to Know It is presenting is to have case where there are description of the symptoms on the patients, and then by that symptoms they have to know where is the lesion. So to know that in that part, if they have symptoms on one side and the other all on one side, and then you have a tongue protrusion from the other side, they should know that that is in the rostral medulla, and then they should read that this is a case description, that this is one medial medullary syndrome, because hypoglossal nerve is there positioned, and medial meniscus is positioned there, corticospinal tract, and symptoms are described in the case. And for the sake of time, I will a little bit cut this shorter. But one thing, what I'm very excited with the brainstem syndromes, and one of the brainstem syndromes, which is very good to explain also horizontal eye movement, which are kind of hard to teach, is locked-in syndrome. And in locked-in syndrome is a devastating neurological disorder where patients are completely paralyzed and they can move eyes only in vertical direction, up and down, not left and right. So that one this case is pretty well described in the Draw It to Know It, and I combined that explaining that case together with another tutorials, which are the eye movements and the pathologies on eye movement, to explain how eyes move in horizontal direction, and to explain why patient with pontine syndrome, so with lesion of the ventral part of the pons, can move eyes in vertical direction, because that center is not in the pons but in the midbrain. So there's some of the student feedback is over the years is that students sometimes they complain that take forever to draw. Even I tell them, like, so your drawings are graded by completion, and so it is for you. And this is like I will not grade you based on the how beautiful your images are, but they need to be accurate. So sometimes they are very particular, and then they spend too much time, but they learn by the semester, or as course progress, to take less time. So also you can, I didn't show you that, but when they draw along, they can use starter images or pre-label images, and sometimes they use those if they are kind of rushing time, and I do not penalize them for that. So so this comment shows that looking back on the assignment, it was huge help for the studying. So some find it confusing, but most of them are, because there are more information, but majority of students love it. And then they actually, some of the students who took my class and end up in medical school, they said in medical school they're using Draw It to Know It, and then they remember drawing the same thing, and then they were grateful for being exposed at an undergraduate level. So, and this one comment is, I think the tutorials help reinforce the information we learn in the class, and that is, I was happy to see that comment. But not all students like Draw It to Know It. Majority does, but some complain that they're spending too much time, because I think the most of the reason is because they are very, like, they pay attention to more detail than they should. So in conclusion, I think their Draw It to Know It are very easy to use, interactive tool. They connect neuroanatomy with clinical symptoms, explain very well, neural pathways are very well explained. Quizzes are excellent tool for self-assessment that could be used, and I use them during class to emphasize the concepts. Of course, some of the quizzes I go on my PowerPoint and my syllabus. So some quizzes are more detailed and are more geared toward medical students, and then I use some on the appropriate level for my class, but they are pretty nice questions. So, as I said, students like tutorials, sometimes struggle to finish on time drawing during short courses, such as my master class. And I think it's important for instructors to re-emphasize the drawings do not have to be perfect, that students should redraw some simplified images before taking exams, and go back to tutorials and rewatch them during exams. This is my part of my presentation. So I would like to end up my presentation with this slide, which I want to emphasize that there are free trial for instructors and students for the full semester. If you want to try, there are different, beside neuroanatomy, there are different tutorial, different disciplines. Anatomy, physiology tutorials are very nice as well. I use them as well in my classes. And other, they have different tests, preparation for different tests. There are over 1,000 tutorials, quiz questions, and and then this is QR code. You can try. It is integrated with Canvas, Blackboard, and any LMS as well, which is very nice feature as well. And I would like to take your questions. So thank you.
Thank you, Dr. Filipovic, for a wonderful presentation. And so we'd like to open up the floor to questions, and we have quite a few, or we have several questions in the Q&A. So, but I'd like to be sure to give the audience a chance to ask questions at this time. Well, one interesting question in terms of teaching and education in the Q&A was what levels of Bloom's taxonomy are in the Ditki quizzes? And I guess I'd follow up too, or Dr. Filipovic, can you use Ditki to sort of layer the complexity or challenge of the questions in the quizzes?
Yes, definitely. I use terminology which is in the Draw to Know It, and neuroanatomy. One of challenge of the neuroanatomy, there are a lot of terms to memorize, and sometimes they are differently described in different textbooks. So I try to use the same terminology as a Draw to Know It, and then some, like orientation, for example, in the slides, that to make less confusing for students, because it's already not easy subject to teach. I'm not sure if that answers your question.
Yeah, and I'll just say we use the Terminologia Anatomica for standard terms, but understanding that things are used differently, more commonly. For instance, basal ganglia is just used instead of basal motor nuclei, but we make sure we include that. So try to have a lot of context references for consistency.
Yes, another one is like medial lemniscus system or dorsal column system. Some use pyramidal system, some don't use pyramidal system. There is a lot of redundancy in terminology in neuroanatomy.
Another question that came up, and this has to do as we interface with scholarly work and with Dr. Fitch and Ms. Harris here, it's to whether or not people can incorporate Ditki into their educational projects, and even if with the intention of those projects being published, what are the possibilities and opportunities there? And we can also have people reach out to you later, but if you could address that.
Yeah, we'd love that in every way, shape, and form. Our idea with all of this is that this is a springboard for your creativity and your interests. So absolutely.
And I'll drop a link in the chat because we have had other faculty members either publish posters or give presentations. They go to conferences and they talk about their research with us. So I'll put a link in the chat that will include some of that past work, and we welcome you to reach out to us and for anything you might need to support that research.
Another important question in the Q&A was just a clarification of who creates the content, and number one, and then along lines, I think, is there ever an opportunity for others to help create that content?
Yeah, so the content's created, it's been being created over the past 15 years now by a team of MD, PhD, and master's science individuals, but it's a really, really, I won't bore you with the details, but it's a very complicated process because the art and the text is done by the author, and that's intentional so that there's a perfect matchup and that you can make it as visually lean as possible. The idea is to have someone who's taught the material write the information so that they can communicate it to students in the way they would do. And one of the big things that we're trying to reconcile is not having passive text written by an author and then a medical illustrationist who's sort of removed from that, try to kind of merge it. So it's a very intricate process. And we're always looking for new opportunities for additional tutorials to your point, or to your question. And in fact, we're looking at kind of working on speech and swallowing because we have a lot of speech pathology folks who use us. But I think the biggest thing that we've been trying to do is to meet one of Dr. Filipovic's, what she brought up is just this level of intent. So making sure that the tutorial matches the level of interest of the student. Because I think the worst thing we can do is bombard them with too much information. So we're constantly working on scaling that back and finding sort of interesting ways to do that.
Just to remind people that Ditki includes a very large collection of modules that cover the anatomy and physiology really across organ systems, and also interfaces with pathophysiology, and really can cut through and work through all the various education levels. And then as Dr. Fitch highlighted, also different professional curricula too. So everything from speech pathology in some cases to PA, and also I think for undergraduates it's really important. I think that's really where you got to hook them in, and I think visual learning tools, Ditki and others are, as Dr. Filipovic has shown, is it's just so important to get them, I think, to be a little more creative in their thinking and learning, and to get them more comfortable with being outside the classroom and learning and studying and practicing. So
yeah, what I also did not mention that there are also slides. You enjoy to know there are slides, PowerPoint slides you can use also for your building your lectures, which are very useful as well. Besides quizzes and tutorials, there are also lectures, video lectures. So it's not only growing tutorials, you have other resources as well to incorporate in your classes.
Yeah, I'd be remiss if I didn't mention too, because we get a lot of interest for this, but the exercises that Dr. Filipovic showed,
Yeah.
you can now, we can work with you to build custom tutorials that will appear on your study plan, only your study plan, not across the website for everybody, but just for your students, your study plan. And we can translate your PowerPoints into exercises that your students can then do. So we're excited to work with anybody on that.
We have quite a few, obviously, we have some international attendees in the webinar right now, and who are interested. And so one question they had is whether or not Ditki is available only in English, or if there might be other languages in the system.
Yeah, we currently support Spanish, French, German, but if there's another language that we can translate it to, we're happy to. Fortunately, there's been a lot of technology that's helpful with that.
Another general question, and I think this can apply to a lot of learning tools. Universities can subscribe to Ditki and other learning tools that are available to us, and often we don't know. So I think oftentimes you actually have to go to your library or to your curriculum office and find out. And I know I was pleasantly surprised to find out that my school actually was a subscriber, and that made a huge difference. And so I think it's important, for all of us, with ebooks coming along, those are available through the library, often with textbooks, and that saves our students a lot of money and still offers them a great tool. I think it's important that we, you got to go in there and look on your library site for that.
Yeah,
So,
we've been stunned because we've been going to the meetings and meeting people who didn't realize that they actually have access to the site already. So it's pretty cool.
I'll put a link in the chat. It's for institutional registration, but before you fill it out, you can use the drop-down menu, and it has the list of all of the schools that have access to Ditki. So if you just want to do a quick check, you can see if your school's on that list. And if it's not, and you'd like for it to be, obviously reach out. But that's an easy way to find out too.
And I think the utility and the fact that you can adapt it to your class, and I don't mean just your course, I mean your class of students, and customize it as you need to for your group, I think is really important. And I think that's getting more and more into how we're leaning into personalized education, and trying to meet our group of students where they are and where their level is on their entry. So
Yeah, another thing I'd be remiss if I didn't mention is that we love to help build a study plan for you. So if you send us your curriculum and what your intentions are, we can make sure that we find tutorials that meet your students' level, all the way from exercise physiology for high school, all the way up. And so, because we could just make sure that it meets your needs and work with you on that.
I actually have a question for Dr. Filipovic, and it comes from the Q&A feature as well. Is and you alluded to this and showed a little bit on that table. Do you see a difference in students learning and understanding in terms of, when you integrate these visual learning tools? And I know you've been doing it for a while, but I know in every class there's a student who is reluctant or only use it, when it's assigned to, and everyone kind of has to get used to that. But do you see differences still between those who, between students who really dive in and really embrace visual learning tools and those that aren't so enthusiastic about it?
Yeah, of course. So in my, for example, undergraduate course, this different diversity of students who are taking. Some are pre-med, some are psychology, depend on their background. Some has better background when they come to my class and they kind of understand better, and then they have easier time with the draw it to know it. And some are not that enthusiastic. You cannot have like whole class enthusiastic. That will be not possible. But I think that my role, as I see, is to make them excited. And if I'm excited, and then when I draw, I'm excited, and then to try to make that funny, so that they will be more interested to draw. And some of the students really show me their portfolio at the end of the class, and I was like, oh God, this is phenomenal. And some are really like very minimally draw. But I think that since I start using these drawing tutorials, they do better in exams, and then they understand better. And then when we discuss in the class, they can answers the questions better. So overall, I think that helped them, because it is without any like conceptual maps and drawing, it will be very hard to connect, especially for the brainstem and a lot of structures which could be damage in the different pathologies. I also teach, I also use some of the tutorials from the vascular supply, which I didn't show, so which for the stroke patients and for different pathologies. So they're also very good, very well made, and then make students understand better symptoms in patients.
Yeah, I mean, I have to say, like, having done this 20 years, the act of drawing something out forces you to commit to an answer, and then the system, software is able to immediately show you where you're right and wrong, and it's just a great way to assess what you truly know. And just because we're running out of time, but my mentor forced me to get up and teach the cranial nerves, 25 years ago, after studying them for a month, and that was just the absolute most best test on my knowledge, was stand up at a whiteboard and try and draw it out.
Yeah, definitely.
It is really important to emphasize that. I mean, just as soon as you bring in your other sensory and physical abilities and visual, and really visualize it and do it with pencil to paper, it really helps. It really makes a difference, and we know that.
And what I'm trying to have like lecture and lab every other week lab, or even to break my class into one part is lecture and lab, then they can also dissect, and then they can have that 3D image and then drawing, and then all different ways to understand how brain works and how it's connected.
So we've had a couple inquiries in the various chats as to whether or not you can obtain or access a free trial for Ditki. I just want to highlight at the Center for Physiology Education under resources, there is a link to Ditki to check it out. And there's also resources for other educational tools. So please check that out there.
Yeah, we offer a full semester trial. So we'd love to help you get set up. You not just for you, but your students as well, because we fully believe in kind of getting that running start before you would ever invest in something.
And I can put a link to the form to fill out for the free trial in the chat, but you can also just reach out to us at support@ditki.com.
Thank you. Thank you, Amy. We're just about ready to wind down. I don't know if Dr. Filipovic would just like to give a closing remark.
So thank you so much for inviting me. I really appreciate your invitation, and I'm very excited to give this talk, and I hope that it helps some people and students.
Thank you.
Thank you.
Well, I want to formally thank Dr. Filipovic just providing us with the insights into these new tools. She really put out there some creativity and was honest about her struggle, and we appreciate that about what a difference it makes when you start using Ditki and other visual tools and really being creative and meeting your students. So I want to thank the audience for attending today. I also want to thank Dr. Fitch, and I want to thank Ms. Harris. And I truly want to thank Ditki for sponsoring this and giving us this opportunity. Before you sign off, if you can take some time to just complete a short survey about the session, and also an opportunity about your interest in future webinars. Thank you again, and I really do appreciate the audience, our presenters, and also our supporters. So thank you.
Thank you.
Thank you.
Thank you, everyone. Have a good day.